Diabetes Triple Check is an app used in clinic waiting rooms to help you with patient lifestyle changes. There are many rewards for enhancing the clinical care by improving billing and the patient outcomes. 3 big lifestyle issues make up what we call the chronic disease triple threat. Diabetes and obesity are epidemics. When you add smoking, it is what we call the triple threat. As we see it, these 3 are the gateway. 9 of the top 10 chronic diseases are influenced by poor diet, inactivity, and smoking in some way. The U.S. Preventative Services Task Force has several recommendations directly related to the triple threat: obesity screening, smoking cessation, daily low-dose aspirin, CVD prevention, and diabetes screening. 73% will die of a top 10 chronic disease. Health plans must provide the USPSTF Grade A and B recommendations. Early intervention saves money for the patient and insurer. Today, we are all addicted to gadgets and smartphones. Diabetes Triple Check jumps into the patient's attention stream. Who has the time? There is a national doctor shortage. For many, office visits are for a right-now issue, like a cough or sprain. The early-stage patients are too busy to schedule a prevention visit. When prevention is discussed, too often it's not billed. If prevention is not discussed, is there legal exposure? Our solution is to help find more time for you. We know that clinical staff is busy now, but all the patients waiting in the lobby have time. While they wait, they should be using the Diabetes Triple Check. The DTC app will ask the simple questions. The DTC app will calculate the 4 risk assessments, and the patient will see the results. The app gives them a first opinion, if you will, with results provided to the doctor for the clinical decisions. How DTC saves time is the doctor has a triple threat summary from the app screen, or a paper copy with limited staff effort. As we see it, the app time is under the physician's direct supervision and part of a complex decision process. Your enhanced care can be part of a billable prevention event. We suggest an article from the Journal of Family Practice. The article is the top 10 billing and coding tips, and here are a couple of key components from that article. Document and bill more 99214s. Expert coders reveal that physicians undercode 1/3 of their established patient visits. Billing for 213s when the visit justified a 214. The article also provides information about when to bill for preventative and EM services and charging for patient counseling. Another important note in the article is you can bill for a 99214 visit without having to count or document individual body systems or detailed exam elements. A new diagnosis with a prescription, an order for laboratory tests or x-rays, or a request for a specialty consult are all examples of moderately complex decision-making. For a billing to English translation, each doctor can easily find 3 patients a day, at least 1 needing smoking counseling, 1 needing obesity counseling, and 1 needing CVD risk prevention. That should add over 2,000 in billing each and every month, not including lab tests for lipids or glucose. Diabetes Triple Check uses medically proven tools for the risk assessment. For prediabetes, we have the CDC Prediabetes Screening Tool, and the BANG tool is the core tool used by the ADA, and it measures risk for both pre and diabetes, as does the Diabetes Risk Calculator from HICAS. The stroke assessment is the stroke scorecard from the National Stroke Association. We also ask about smoking and aspirin use, all in one set of questions. Behavior persuasion. Diabetes Triple Check sets the stage for the doctor's advice by preparing the patients for prevention. The patients saw their results for themselves, generating questions about their health. When the doctor advises, the words are important to keep the accountability with the patients, like, "Your answers produce the results of blank. I think we should blank." With that format, patients can't disagree with their own answers. We know time is money, and money is billing. Some preventions that are easily billable: counseling on smoking cessation, obesity counseling on diet and exercise, cardiovascular disease prevention, as well as the diabetes and blood testing. Clinic personalization is in yellow, with the clinic name, street address, telephone number, as well as links to your website and patient email link. There is a built-in outreach effort as the doctor can suggest the patient use the app to test family and friends. They will know what clinic to go to with your clinic listed inside. How Diabetes Triple Check helps you. We help with the USP-STF compliance and managing risk with proven tools. A recent study shows the average diabetic pays $10,000 more per year for health care. So prevention will solve the patient's needs and save insurers big money. Applying billing and coding tips for handling concurrent needs means reimbursement. And acquire new patients from others, showing your app to friends and family. With your enhanced care, the patient wins, the insurers win, and your clinic wins. What are the next steps to use Diabetes Triple Check in your clinic? Request our implementation guide. Review with your staff and billing experts. Acquire tablets to use in your lobby for those without smartphones. We suggest you keep using DTC to keep it in front of the more stubborn patients. Take action now, because the enhanced care you provide and the billings are missed every month of waiting. Thank you for watching our clinical video. Remember Diabetes Triple Check to help fight the triple threat. Visit us at our website, diabetestriplecheck.com, or you can scan the QR code with your mobile device, and the link will redirect you to the App Store to download for free.